today I'm just going to discuss about one of the very important thing that anybody who have diabetes they should do. So few things if they do it in a lifetime, so that will definitely help you in managing your diabetes and also have a better quality of diabetes. Always one thing you have to think, so I am seeing patients with diabetes for more than 40 years and they are 80 plus, they are having a better quality of life. They don't know that they just have diabetes itself. They just come and see me just to once in 3 months to say hi, and the reports as such every time they see they bring it under control. What I'm just trying to tell is, if you have a diabetes, you just form a team. So it's always teamwork works. So it is not a physician alone. The healthcare team you develop so is going to help you in a lot of ways to improve your glycemic control, the diabetes control, as well as you can have a better care with all things. There are a lot of things we have to concern. When you have a diabetes, it's not alone just bringing the glycemic control, good control, but also at the same times how to prevent your heart and kidney, how to protect your foot, how to manage your eyes, and what are the tests you have to do it on a particular time to prevent you from getting into complications of the futures. So few things I will just discuss today, so which will help you in having a healthy life during this diabetes journey. You don't think about you have diabetes when you just follow these tips. So first thing is actually there are 4 pillars of diabetes care is there. So one is the healthy nutrition. So you just identify a healthcare team who have a better nutritional things. It's not just a thing that we know, we have a knowledge about basic nutrition, but when you have a nutritionist with you who can have a health tips about how to manage your diet, they will give a health tips, and if you follow it religiously, you can have a better control with the glycemic, and also the dosage of medication can also be reduced. The other thing is about the exercise. There are a lot of myths about exercise. So what we have to do, what we should not do. So basically the guideline recommends 30 minutes daily, at least 5 days a week, which is going to help you in managing your glycemic control, and also some flexibility exercise, some stretch exercise, and also not leading a sedentary lifestyle. We should walk at least 10 minutes after 30 minutes or 45 minutes of sitting for some time. So these are all the basic exercise tips and you have to follow. The other thing is monitoring, and monitoring in the sense, so what type of things you have to do during a particular time. So every time actually when you visit a doctor, it is not the thing you have to do a battery of tests. So it is actually discussed with your doctor. You have to do a test at a particular time. When you have a diabetes, you go for a HbA1c, that's called the average blood sugar, glycosylated hemoglobin, once in 3 months, and aim for HbA1c around 7, and it depends upon the age of the patient and also the other comorbid illness. Like example, patient is having a kidney problem or liver problem. It is individualized, and your doctors will discuss with the things. What is your target HbA1c you can keep, so that you can have a better quality of life, that you have to discuss. The other parameters you have to check basically is their blood pressure monitoring in every visit, and even if you have a little high BP, you closely monitor in a frequent regular intervals, so that you can adjust your regular medication dosage also after discussing with your doctor. The other thing is the cholesterol. So cholesterol, the lipid profile which you can do, that will identify your good cholesterol and bad cholesterol. So the good cholesterol HDL, it should be above 45 for male, and for female it should be more than 50, and the LDL cholesterol, that's a bad cholesterol, it should be less than 100. And the other cholesterol called the triglyceride, which is going to deposit the fatty things in the liver. So and also it can just go high in a diabetes, especially if it is not controlled. It should be less than 150. So these are all the numbers you should know, and also you can discuss with your doctor. So this is the basic parameters. You have to do it on a routine things. Lipid profile you can do once in 6 months. If it is controlled, then you can do it once in a year. The basic other test you can do is your kidney functions, the urea creatinine, and then the microalbumin test, that is a urine test, that will identify any kidney damage. This you can do it in once in a year. And other test what I just took is a basic workup, like you can just do the ECG, the echocardiogram once in a year to identify your heart functions. And the main important thing you have to do is your eye checkup at least once in a year. You have to go for things to rule out any eye changes, especially to rule out the diabetic retinopathy. So these are all the basic things you have to do. And the more important thing what you have to do is you just monitor your foot. So whenever you go and visit the physician on every visit, and also like we care more about our face, and when you have a diabetes, your foot care is more important than the face care. You have a separate mirror for checking your foot. So you have to just check your feet regularly to identify any small changes in the feet. So these are all the things you have to just monitor. And fourth pillar comes the medication and follow. So this you have done. So diet, exercise, and then the monitoring. Next thing comes about the medications. So medications always the common mistake people will do is once a doctor prescribes the medications, they themselves do the self monitoring. Sometimes they won't follow. So they check the self monitoring. Where self monitoring in the sense they check it as a random. They think if it is normal, why we have to meet the doctor? So they avoid meeting the doctors. So if they just constantly keep in touch with the doctors, they will adjust the medications. They will identify which medicines work for you, and they can give a tailored dosage of medications that will just improve glycemic control and prevent the complications in the future. So this is the one thing they have to do it. But how about the visit doctor? If you ask me, yearly 4 times if you visit the doctor, that is enough. So that will reduce your chance of hospitalization in the future also. So once in 3 months you check your HbA1c and meet your physician and take the medications what you advise, and 4 visits that will enough for you to just bring the glycemic level under control. So this is a basic tips, the 4 pillars. If you follow, you don't worry about that you have diabetes itself.